I think there's a lot of information out there about periodontal disease, but not enough, quite frankly, because it's so prevalent. Like you said, people will come here and they've literally seen a dentist within a year. My hygienists are really good at diagnosing and explaining, because the key to anything in healthcare is that if there's something wrong, you want to detect it early. So, they'll measure all the pockets, be very objective about it, but there's always that subjective component because, like you said, most people don't know they have it. It doesn't hurt. They might have some bleeding. For some reason, bleeding of the mouth is related to differently than bleeding anywhere else in your body. If anything in my body bled on a daily basis, I would go get it treated. But I have patients all the time that will mark on the questionnaire, my gums bleed when I brush. Well, that's not okay. There's something wrong there. And so, that's the foundation of your teeth. But more importantly than that, now we know that periodontal disease can affect pregnant mothers, preterm low birth weight babies. It can affect your heart health, your brain health, increases your risk of all sorts of things. And so for so long we treated the mouth like it was a separate unit, but now we know that bacteria doesn't stay in those pockets in the gums. They can go wherever they want. Now, your immune system usually does a pretty good job of fighting that, but if you ever are at high stress levels or sick for an ongoing amount of time, you don't know where that bacteria is going to end up, and they find it anywhere. And so it can be deadly. And most of my patients certainly aren't in that realm, but left neglected long enough, that's where things can end up. And so if we can treat that and educate them, and it can be tricky because they don't see it, they don't feel it, they don't know it, and all of a sudden you spring this on them that, we've got some advanced periodontal issues that we're going to have to take care of, or else it can be difficult to understand. And so we want to make sure that the patients can see what we can see. If there's bleeding, if there's pockets on the x-rays, if there's buildup underneath the gum line, my hygienists are fantastic at educating the patient about all those things, and so that they can feel like they're getting the best care here and that we're advising them to do exactly what I'd advise my brother, my mother, my sister to do, and that's catch those things at the early stages.